Hi, my name's Aaron, and I'm a patient navigator. And patient navigators help to guide patients who have suspicious findings and test to show they may have cancer. Through this process, patient navigators help the patient through barriers in the cancer care system. Though all of this is as the navigator, you can ensure the patient a timely diagnosis and treatment plan. As a patient navigator, it is my job to ensure people get the necessary help that they need and to make sure they do not face any barriers throughout the treatment process. Tobacco and alcohol dependence is a major problem in the United States, but over the last 50 years, the amount of people who smoke has gone down and it is a major public health success. The use of tobacco remains the largest preventable disease in the U.S. Death due to the use of tobacco remains at about 440,000 deaths annually in the United States and 6 million worldwide. Smoking and other forms of tobacco use cause heart diseases that account for many of these average deaths. Cancer is another major disease that comes from the use of tobacco products. The consumption of alcohol has risen over the past few years and then contributes to over 60 types of diseases. Overconsumption of alcohol and alcohol-related deaths are just behind tobacco deaths. Drinking and driving is a cause for 20% of road traffic deaths, 30% of esophageal and liver cancers. Epilepsy and homicide, as well as 50% of all deaths, occur because of liver cirrhosis. There are many things that cause people to use different tobacco products. Nearly 1 in every 5 adults 18 years of age or older smoke or have tried smoking. Smoking in men is a higher percentage than in women, with 21.6% of men compared to 16.5% of women who smoke. Because of the nicotine in the tar produced by cigarettes, people who smoke become dependent on the nicotine, developing an addiction. Upon inhaling the smoke from the cigarette, it takes about 7 to 10 seconds from the smoke to travel through the lungs to the heart and then to the brain, which causes the addiction. Many people are driven to alcohol dependence for different reasons. It can be anything from stress to a tragedy, but it's harmful to the person's health. Many times in young people, alcohol is involved in serious accidents, traumas, and suicide cases. There are different types of drinkers, and they include hazardous and harmful drinkers. Hazardous drinkers repeat certain drinking patterns and increase the risk of physical or psychological problems, whereas harmful drinkers are defined by the presence of these problems. There are many ways people are trying to support the efforts to quit using tobacco products. One way the government itself has tried to reduce the use of tobacco products is by implementing a tobacco tax, a higher tax on tobacco products. This may cause people to quit because many people who use tobacco products, especially who smoke cigarettes, are below the poverty line and may soon not be able to afford tobacco products. There are other ways in which individuals themselves can try to quit. Education is one of the most important things when a patient wants to quit using tobacco products. There are therapies and medications to help someone who wants to quit. Alcohol dependence prevention is very important, and it is important to understand the different types of interventions and therapies that are available to those who suffer from alcoholism. It is hard to say that we can stop the use of tobacco completely in the United States, but as a more realistic solution would try to be to have the younger generations refrain from using it at an early age and have them not be exposed to it. Educating youth about the dangers of tobacco use is important because if they understand at a young age that tobacco can kill them, then the likelihood of them using tobacco goes down as they become adults. Required information seminars in schools at a young age could help be one way to have young children understand the dangers when it comes to using tobacco. These tobacco uses can kill them, and if they understand it at a young age, they may not use them when they get older. Alcoholism is another disease that I believe is unrealistic that we could stop altogether. However, I believe that there are things that we can do as a society to help people suffering from this disease and try to prevent it as a future problem for generations to come. People who are suffering from alcoholism should attend regular classes, which many of them do already, but many people try to solve the problems on their own. Also, people need to be more informed about the consequences of drinking and driving. Drunk driving not only puts the person driving at risk, but anyone who's in the car with them or anyone who is on the road at the same time as that person. Brief interventions for alcoholism are one of the most effective ways for people who are drinking an excessive amount or have a regular drinking pattern. For people seeking treatment, there are different types of therapies that help people overcome the dependence of alcohol. For my debriefing, I feel like I represented myself professionally by dressing as someone who would dress in a healthcare environment, and these people understand the struggles that people go through, and understanding the needs of the patients is important. I think I make my point that we need to lower the use of tobacco and alcohol products because tobacco use is the most preventable disease in the United States and worldwide. Alcoholism follows just behind the use of tobacco products, yet people still continue to use both products that are tobacco and alcohol. I believe the problem is that even though roughly 440,000 people die every year from tobacco use, it is still a major health problem, and people continue to smoke. People who excessively drink develop liver diseases and different types of cancers that they hurt themselves or people around them. The impact of these issues is that people are dying every day from alcohol and the use of tobacco products, but we still allow people to use them excessively, and little is being done. I feel like my solution to increase the prevention and awareness of both issues was presented and could be adopted by a stakeholder. I feel like I presented this issue well, but could have gave a better overall presentation with more practice and understanding of the issues.